The disease we chose to explore was the swine flu. This is a form of influenza that affects pigs, or influenza that is caused by a related virus. When the disease is contracted, it attacks cells that line the respiratory tract, replicating inside each cell until the cell dies, releasing more of the virus into the body. The swine flu originated in 1998, found in pigs in 4 U.S. states. The part of your body that is affected is the respiratory, which includes the throat, nose, and lungs. A common name that is often referred to when talking about the swine flu is H1N1. Symptoms may include body aches, coughing, runny or stuffy nose, sore throat, chills, diarrhea, fatigue, nausea, fever, and vomiting. These symptoms are not always severe, but when they are, they have an 11% fatality rate.
How is it transmitted? As said before, swine flu originated from pigs. You can contract this virus by having contact with infected pigs, or even just being in the same area where those pigs have been can infect a human. Also, humans contributed to the spread of this disease. Just like any other flu, H1N1 can spread through coughs and sneezes, or, for example, by touching contaminated objects like a doorknob or table that someone infected just sneezed on. You are likely to have touched these germs and then touch your mouth or some part of your face. You cannot get the H1N1 influenza from eating pork products. Swine influenza has not been shown to be capable of transmitting to people through eating properly handled and prepared pork or other products derived from pigs. The swine flu pandemic of 2009 may have killed up to 200,000 people worldwide. The H1N1 virus first appeared in Mexico in 2009 and rapidly spread around the world. Looking only at deaths from pneumonia that may have been the cause by the flu, they found that Mexico, Argentina, and Brazil had the highest death rates from the pandemic in the world. The toll was far lower in New Zealand, Australia, and most parts of Europe. On the 24th of October 2009, U.S. President Obama declared swine flu a national emergency. After the pandemic, a study found that the majority of deaths occurred in Africa and Southeast Asia. Every year, people get sick with the flu, and every year, some people die or are hospitalized from the flu. With the H1N1 flu, the people who are most likely to get the flu and who may get the sickest are pregnant women, children under 5 years old, people of any age with chronic medical conditions such as asthma, diabetes, or lung disease. People under 19 years old who are receiving long-term aspirin therapy, people 65 years or older, and residents of nursing homes and other chronic care facilities. What could be done to prevent yourself from getting the swine flu is a vaccination. The injectable form of H1N1 influenza virus vaccine is a killed virus vaccine and will not cause you to become ill with the swine flu virus. Ways to prevent yourself from getting the virus are covering your mouth and nose when you sneeze or cough. Also be sure to keep your hands clean by washing them with warm soap and water. In 2011, a study from the U.S. Flu Vaccine Effectiveness Network estimated the overall effectiveness of all pandemic H1N1 vaccines at 56%. A CDC study released January 28, 2013, estimated that the pandemic H1N1 vaccine saved roughly 300 lives and prevented about 1 million illnesses in the U.S. The study concluded that had the vaccination program started 2 weeks earlier, close to 60% more cases would have been prevented.
How could you get rid of the swine flu? First off, it can have something to do with your hygiene. You just want to make sure you wash your hands before eating, simple things like that. However, the best bet is to make sure your vaccines are up to date. If you don't get vaccinated and you come in contact with the swine flu, you should see your doctor immediately. Then you can treat the virus similar to how you would treat the regular flu. You'd want to get plenty of rest, and also you should definitely take some sort of throat lozenges. Not only that, but you could also take cough syrup, non-steroidal anti-inflammatory drugs. In order for you to be diagnosed, when you go to your doctor, they would either do a nose or throat swab. Then it would take roughly 15 minutes for the results to come back. When they come back, it would tell you whether or not you have type A or type B. You would usually never have to get surgery when having the swine flu. However, if your symptoms are actually very bad, then you can get either your blood drawn or you would do x-rays.